Hi, my name is Lindsay Smith. This is for NURS-7102 Advanced Nerve Health Assessment. This is my head-to-toe assessment for spring 2025, and today is March 29th, 2025. I am going to start off by scanning the room. I'm going to scan the ceiling. And I'm going to scan the floor. Four. Oop. And then these are my supplies here on this table. And where the camera is positioned. Okay. All right, so now and throughout the assessment, I'm going to be assessing the skin for color, temperature, moisture, turgor, edema, texture, bruising, scarring, lesions, or nevi. I'm going to start by assessing the head. I'm looking for it to be symmetrical. I'm going to look at the top of the head. I'm going to assess hair color, distribution, texture. I'm looking for any masses, depressions, or infestations. I am going to palpate the temporal arteries for tenderness. Any tenderness? No. Okay. I'm going to have you open and close your jaw. Good. Assessing for TMJ and feeling for any type of crepitus or clicking. I'm going to assess the lymph nodes. So we've got preauricular, postauricular. I've got occipital, good, tonsillar, submandibular, and submental. Okay. I've got anterior cervical and posterior cervical and supraclavicular. I'm going to assess cranial nerve number 5, trigeminal. So I'm going to have you clench your jaw. Good. That's the motor. I'm feeling for that masseter muscle. I'm going to assess sensory. Have you close your eyes. Tell me where I'm touching.
Forehead, cheek, chin, cheek, nose.
Good. I'm now going to move on to the ears. So again, I'm looking, I'm going to assess cranial nerve number 7, facial. So I'm going to have you smile, puff out your cheeks, purse your lips, frown, furrow the eyebrows. Good. I'm now going to move on to the ear. So I'm going to look at, again, looking for it to be symmetrical. I'm going to assess the pinna and the tragus, the auricle and tragus, and I am feeling for any type of nodules or masses. I'm going to now look in the ear with my otoscope. And so I'm going to assess that auditory canal, looking for it to be clear, and its membrane, pearly gray. Clear and pearly gray. Good. I'm going to now test cranial nerve number 8, which is auditory. So I'm going to have you cover one ear. I'm going to stand behind you, and I'm going to whisper. I want you to repeat after me.
1, 2, 3.
Good. No brother.
1, 2, 3.
Good. I'm now going to do the Weber test. So I am going to touch the tuning fork to the top of your head. You're going to let me know if you hear it better in one ear or the other, or if you hear it the same in both.
Same.
Good. I'm now going to do the Renee test. So I'm going to touch the tuning fork to the bone behind your ear. You're going to tell me when you stop hearing it. I'm going to hold it in front of your ear. You're going to tell me when you stop hearing it, okay? Oop.
Okay. All right.
Good. I'm going to repeat it on the other side.
Okay. Okay.
Ear connection is better than bone connection. You heard it about twice as long in front of the ear than behind the ear. So now we're going to move on to the eyes. So again, I'm going to take off your glasses. I'm going to assess the eyebrows, the eyelashes, the palpebral fissures. I'm looking for symmetry. Again, I'm going to look up for me. Yep, I'm assessing the conjunctiva and sclera for color, any redness, any drainage, any lesions. I'm going to test cranial nerve number 2, optic. So I'm going to hold this out. I want you to read the lowest, cover one eye, or read the smallest line you can.
LT.
Okay, cover your other eye, the smallest line you can.
FTH.
Okay, all right, repeat it one more time.
EFH.
Okay.
LT.
And then both eyes.
FFH or FEH.
Okay, so that's 20/70 vision. All right, now I'm going to assess the internal structures of the eye. So I'm going to use my ophthalmoscope. I'm going to go in from the side. I'm looking for that red reflex. Follow it in. Looking for that optic nerve and the internal structures of the eye. So again, from the side, red reflex. Follow it in. Looking for that defined borders of the optic disc. And looking for any abnormal findings. And so then I'm going to test cranial nerve number 3, ocular motor. So I'm going to shine a light in your eye. Just look straight ahead. Good. Good. Pupils finding well the light. Follow my finger in. Just your eyes. Good. So pupils are equal reactive to light and accommodation with good convergence. You can put your glasses back on now. All right. So now I'm going to test for cranial nerves 3, 4, and 6, ocular motor, trigeminal, and abducens. So just follow my finger with just your eyes. Good. I'm now going to move on to cranial nerve number 1, olfactory. So I'm going to have you close your eyes, cover one nostril, and tell me what you smell.
Vanilla.
Good. Cover your other nostril. Tell me what you smell.
Vanilla.
Good. All right. And again, I'm assessing that nose. I'm looking for it to be equal and symmetrical. All right. Now I'm going to move on to the mouth. So I'm going to assess the lips, the teeth, the gums. I'm going to assess the buccal mucosa, the posterior pharynx, the salivary glands, the tonsils if they're there, and I'm going to grade them, as well as the soft palate and the floor of the mouth under the tongue. While I'm doing that, I'm going to assess cranial nerves 9 and 10, which is glossopharyngeal and vagus, and I'm going to have him say, stick out your tongue, say ah.
Ah.
Lift up your tongue.
Ah.
Good. And so with that cranial nerves 9 to 10, that uvula rises symmetrically with phonation. The uvula and soft palate rise with phonation. Now I'm going to test cranial nerve number 12, hypoglossal. I want you to stick out your tongue, move side to side, up and down. Tongue moves steadily without fasciculations. All right, now we're going to assess the neck. So I'm assessing that trachea. I want to make sure that it is symmetrical and midline. I'm going to go behind the patient. I'm going to assess the thyroid gland. So I'm going to palpate and swallow. Good. Palpate and swallow. Good. I'm going to palpate the carotid arteries. Good. Good. And I'm going to listen to those carotid arteries for any bruise. Good. All right. So now I'm going to have you spin around, or just kind of spin to the side. Yeah, go ahead and spin all the way around. Good. That's it. So now I'm going to assess the posterior chest. So during my respiratory assessment, I'm going to be looking for any signs of respiratory distress. So I'm looking for any type of dyspnea, tachypnea, pursed lip breathing, tripod breathing, any retractions. I'm going to start first by palpating for equal chest expansion. So just breathe for me. Breathe. Breathe. We're now going to assess for tactile fremitus. So I want you to say 99 as I move my hands down.
99.
Good. I'm now going to percuss in the intercostal fields. I'm now going to auscultate in the intercostal fields, and as I move, just take a breath. All right, breathe. Just as you feel my stethoscope move. I'm going to listen bilaterally and medially. Good. I'm now going to assess for egophony. So as I move down, I want you to say E for me.
E, 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 E.
Good. I'm now going to assess for bronchophony. So as I move down, I want you to say 99.
99, 99.
Good. Now I'm going to assess for whisper prolonging. So as I move down, I want you to say, I want you to whisper 1, 2, 3. Good. All right, you can go ahead and turn around for me. Good. So now I'm going to assess the anterior chest. Again, I'm looking for that equal and symmetrical chest rise. I'm going to go ahead and palpate for that. Good. I'm going to palpate for tactile fremitus. And so as I move, say 99.
99, 99, 99, 99.
Good. I'm going to now assess for, I'm going to auscultate the anterior lung fields. So as I move, just take a breath. I'm going to assess bilaterally and medially. Good. Now I'm going to move on to the assessment of the heart. So I'm going to listen to all 5 heart sounds. I'm going to listen with both the belt and stethoscope and the diaphragm. So we've got the second intercostal space, right sternal border. We've got aortic. The second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, we've got Erb's point. Fourth intercostal space, left sternal border, we've got tricuspid. And fifth intercostal space, mid-clavicular line, we've got mitral. So once again, with the bell, so we've got aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to palpate for PMI, and then I'm going to auscultate. The apical pulse I would do for a full minute, but for sake of time, the rate is regular and the rhythm is regular. Okay, so now I'm going to go ahead and have you lay down here. I'm going to recline him to about 30 to 45 degrees. Okay, as he's lying down, I am going to be assessing for jugular venous distension. So I'm going to look on both sides. I'm looking for any type of heaves, lifts, or that jugular distension. I am once again going to listen to all 5 points of the heart with the bell and the diaphragm. So once again, we have aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm also at this point going to palpate each of those spots, feeling for any type of thrills, heaves, or lifts. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Good. Now we're going to move on to the abdominal assessment. So I'm going to look at the abdomen. I'm assessing for symmetry. I'm looking at the abdominal contours. I'm looking for any type of distension or masses. I'm going to start by listening to all 4 quadrants for bowel sounds. And then while I'm here, I'm also going to listen to the abdominal arteries. So I've got the aortic, the renal, and this is with the diaphragm, the iliac, and the femoral. Good. I am going to percuss each quadrant of the abdomen. And I'm listening for tympani over all with dullness over the organs. I'm going to palpate each quadrant for any tenderness. Good. Good. I'm going to palpate the liver right under here. Take a deep breath. And then I'm going to palpate the spleen. Take a deep breath. And hold it. Good. And I can't palpate the spleen, which is an expected finding. So I'm going to have you sit back up for me. Back in the chair. Spin this way for me. Lean forward a little bit. I'm going to assess for CVA tenderness. So palpate here. And then turn this way. And palpate here. Any tenderness? Okay. All right. So we spin back around. So now I'm going to assess the upper extremities. Let's get back just a little bit. All right. I'm going to look at your hands. I'm going to look at the joints of the fingers, the wrists, the hands, the elbows, and the shoulders. I'm looking for any type of joint pain, crepitus, redness. I'm going to start by assessing capillary refill. Okay. I'm going to assess radial pulses. Okay. And good. All right, so now I'm going to have you follow me. So fingers, we're going to first flex, extend, hyperextend. We're going to abduct and adduct, and thumb finger opposition. Good. Wrist, flex, extend, hyperextend. We're going to do radial deviation, ulnar deviation, circumduction, rotation. So elbows, flex, extend, hyperextend. Good. Shoulders, we're going to flex, extend, hyperextend. We're going to adduct towards the body, abduct away from the body, circumduction. We're going to do external rotation and internal rotation. Good. All right, and so I'm now going to check strength. So I'm going to have you squeeze my hand. Good. I'm going to have you push towards your body. There you go. And push away. Good. And then shoulder girdle, push in and push away. Good. Cranial nerve 11 vagus, push up. Shrug your shoulders. Good. All right. So now we're going to test cerebellar function. So I'm going to have you take your fingers and move them again. Stall. Just back and forth. Good. Hands on your lap. Flip flop over and over. Perfect. I'm going to have you touch your nose and touch my finger, and then just follow my finger. Touching. Touch. 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 Good. I'm going to have you tell me where, close your eyes, tell me where I'm touching.
Elbow or interior?
Arm.
Arm.
Yeah.
Arm. Calf. Calf.
Good. All right, I'm going to have you keep your eyes closed. I'm going to put an object in your hand. Stick out your hand for me. I want you to tell me what it is. This is testing for stereogenesis.
It's a car.
Good. Other hand.
Battery.
Good. Now we're going to assess for prosthesia. I'm going to draw either a shape or a letter in your palm. You tell me what it is.
Circle.
Good.
X.
Perfect. We're now going to test reflexes. So first, we're going to do the brachioradialis. So yeah, relax. Good. And then brachioradialis on this side. Relax. Good. All right. We're going to do biceps. Good. Biceps. Good. And triceps. So just have your arm hanging kind of loose. All right. This side. This side. I'm going to have you kind of dangle your legs. All right. That's your patellar. Dangle. You can relax. Good. Again, dangle. And we're going to assess the Achilles. All right. And then your Babinsky. So yeah, tickles. All right. Okay, good. We're also going to assess vibratory sensation. So I just want you to tell me if you feel this vibrating. First, going to do on your ulnar prominence. So let me see your hand.
Yep.
All right. Medial.
Yep.
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 Perfect. Okay. So now we're going to move on to the lower extremities. So I'm once again assessing those lower extremities. I'm looking for any type of joint redness, swelling, crepitus, or pain. I'm going to start with the feet. I'm going to assess for capillary refill. Good. Good. I'm assessing the dorsalis pedis pulses. Good. Good. And posterior tibia. Good. Good. All right, so I want you to follow with your toes like my hands. So we're going to flex, extend, hyperextend, abduct, and adduct. All right, again with your ankle, same thing. We're going to flex, extend, hyperextend. We're going to circumduct. Whoop. We're going to do inversion and eversion. Good. All right. So go ahead and stand up for me. No, sorry, sit back down. Okay, I want you to, both feet, I want you to push against me, and then pull back, assessing strength. Good. Push against me with your left knee, push out. Good. And with your hips, push in and push out. And strength is 5-5. All right, now you can stand up. So we're going to test now knee range of motion. So we're going to flex, extend, hyperextend. Good. Flex, extend, hyperextend. Good. And then so hip, we're going to flex, extend, hyperextend, flex, extend, hyperextend. Good. We're going to do adduction, so away from body and away from body. Good. And adduction towards the body, towards the body. Good. We're going to do external rotation, so out. Good. External rotation. Good. And then internal rotation. Good. Internal rotation. Good. And circumduction. Circumduction. Good. Okay. And so now I'm going to have you kind of turn around, face that way. Have you bend over? I'm assessing the curvature of the spine. I want to make sure that that is nice and even and midline. I'm assessing the scapulus for symmetry. You can go ahead and stand up. Now we're going to do range of motion of that lumbar spine. So we're going to flex, extend, hyperextend. We're going to lateral flex, so lateral flexion. Good, good. And then we're going to rotate. Good. Cervical spine now, so we're going to flex, extend. Oh, you can turn this way. Flex, extend, hyperextend, lateral flexion, and circumduction. Good. So now I want you to just stand here and walk that way for me. I'm just observing the gait. Good. You can come back this way. Oh, sorry. Come back this way. And so now I'm going to have you do Romberg. So I'm going to have you close your eyes, stick out your hands. And I'm just looking for any type of sway. All right, good. And then hop on one foot, hop on the other foot, and hop on both feet. All right, perfect. All right, thank you so much.